Like the other types of coronavirus, this one enters our bodies through our mouth, our nose and our eyes. And then it binds to cells in the upper respiratory tract. Now, the most common symptom seems to be fever, and that's part of the immune system's response, evolved, we think, to make the body a less hospitable environment for infections. Inflammation in the throat and in those airways causes that dry cough that lots of patients have, and many people have also reported a total loss of smell and taste. But it's when the virus starts to replicate deep in the lungs that it can become a really serious problem. You might think your lungs are like balloons, but really they're more like sponges. They're full of blood vessels surrounding tiny air sacs. These are the alveoli. This is where oxygen gets from the air into the blood. Now, when cells in the alveoli get infected, it causes a viral pneumonia. Your immune system responds. Chemicals called cytokines draw white blood cells into the area to help fight the infection. This image is a CT scan of someone with severe pneumonia caused by Covid-19. The purple areas are where there's that inflammation, and you can see how much of that lung is affected. In this case, the immune response is starting to get out of control. It's what we call a cytokine storm. Inflammatory fluid and cells starts to fill up the alveoli, preventing oxygen getting into the blood. In severe cases, this is what we call an acute respiratory distress syndrome, or ARDS. Patients like this start having to breathe harder to maintain oxygen levels, and once that effort becomes too great, they need ventilation. And a ventilator is really, in simple terms, a mechanical bellows that can take over the work of breathing. Now, we've seen with some of the recent headlines that there is this spectrum of disease with Covid-19. Some people are totally unaware they've been infected, whilst others lose their lives.